Thank you, Mr. Speaker. Yesterday, this government finally came up with a new plan for H1N1 immunization. Clinics shut for 4 days when there was vaccine available. The Minister of Health finally came up with a plan that should have been in place from the start. To the Premier. The Premier did not answer my question yesterday about wastage of vaccine. Given this criminal waste of potentially life-saving vaccine, will you fire this minister?
The Honourable Premier.
Mr. Speaker, rather than continuing this line of questioning, just want to assure Albertans that the two medical officers of health, Dr. Corvo and, of course, here in Edmonton, Dr. Preddy, had a news conference, also rolled out the plan for the next group of people at risk, when the clinics will be held, and the locations. We've also had a tremendous offer from the City of Calgary and the City of Edmonton, using the Commonwealth here and the Saddle Dome in Calgary. So it looks like even municipalities are coming to help and support, which is the largest vaccination in Alberta's history.
The Honourable Leader.
Thank you, Mr. Speaker. What is the Premier's justification for delaying 4 days to come up with a plan when this plan is what the federal government has been suggesting all along? This clearly shows a willful disregard for expert opinion. Will you now fire this minister?
Mr. Speaker, the minister has been working with the medical officers of health over the weekend and has the information in terms of the expert advice that he received.
The Honourable Minister.
Well, Mr. Speaker, one of the things that the Leader of the Opposition is not focusing on is the fact that we have limited supply. And we have been in conversation with the Chief Medical Officer of Health today, and we have embarked on the plan that we announced, but we also have this issue where next week it's going to be very tight in terms of supply. And so what we don't want to do is stop and start. So it will be a narrow, focused approach rolled out into next week, Mr. Speaker.
Honourable Leader.
Thank you, Mr. Speaker. Well, I acknowledge that the Premier has ensured that there are serious consequences for the decision to provide the Calgary Flames with private vaccine clinic. The Premier fired the most senior bureaucrat. I guess I'm asking the Premier now why he does not fire the most senior person responsible.
The Honourable Premier.
Mr. Speaker, in a previous comment, I talked about the Saddle Dome. It's actually the grandstand. So just want to have everybody going to the wrong place. Please look at the ads, look at the newspapers, go to the website, get the information. But with respect to the issue with the Flames, there's just been a release by the Alberta Health Services Board, by the Chair, and also the President and Chief Executive Officer. And there's information in there in terms of the what action they've already taken and what action they will be taking in the very near future.
Under the new vaccination plan, children 5 and under are receiving the vaccine tomorrow, followed by pregnant women on Friday. People with chronic conditions will not be included in these vaccines, only once there's sufficient supply, but no details are available on this. To the Premier, will a pregnant mother bringing a child under 5 to a clinic receive the vaccine, or will she have to come back on Friday?
The Honourable
Mr. Speaker, it depends on the pregnant woman if she wants to have the vaccine with the adjuvant or without. And without, it'll be offered on Friday. But again, the Minister has the information and can expound further.
Well, Mr. Speaker, somehow the Leader of the Opposition is leaving the impression that only tomorrow we are dealing with children from 6 months to age 5. We have been very clear that we will be through the weekend vaccinating children between the age of 6 months and 5 years. And in addition to that, starting Friday, we will be vaccinating pregnant women. So if a pregnant woman has a child in that age group, she can come from Friday, Saturday, Sunday, Monday.
The Honourable Leader.
When clinics open again tomorrow, they will only be located in Edmonton and Calgary. Yesterday afternoon, I received a number of phone calls from areas like Red Deer and Lethbridge, where they figure into the government's plan. So will the Premier provide some details for Albertans outside the metro areas so they will at least know they're more than an afterthought to the Premier?
Mr. Speaker, I'd like to answer that question because, part of this issue is when responsible medical people are involved in a pandemic, what they try to do is ensure that the public has the best information and not misinformation. Now, this particular member knows full well that if he went to the Alberta Health Services website, he would see all of the locations of the clinics. They're all the same as they were initially when the rollout started. So for him to stand in this House and try to relay misinformation to the public is irresponsible as a medical practitioner.
Thank you, Mr. Speaker. Mr. Speaker, the last 2 weeks have shown disturbing problems with Alberta's pandemic response. Will the Premier both request and support the Auditor General in performing a special investigation into the effectiveness of Alberta's pandemic response?
The Honourable the Premier.
That's your question for today.
Mr. Speaker, I know the two political parties are having a debate on who should ask the question, because I think the third party raised it this morning in public accounts. All I'm asking is, we'll participate in any review by the Auditor General. I have no issue with it. But please don't pull anybody off the front lines that are administering the vaccine to do the interview and create an even longer lineup of people in this province.